Is offering an option for pain relief after surgery.
It happens before surgery begins, and as 6 News' Joe Harris tells us, one patient who went through it is singing its praises.
Dr. Cody Moffitt says he developed knee pain 3 years ago. He's a sports medicine provider at Children's Nebraska and says he knew the pain was not sports related.
The arthritis evolved to the point that my only option was surgery.
For his recovery, he wanted a different way to treat the pain, largely because of his concern over taking opioids.
They're very helpful, but we need to respect them, and I try to prescribe them as little as possible. And if there are ways to treat pain without using opioids, they should be considered.
He says orthopedic surgeon Dr. Bo Kildow suggested a pain relief treatment called Iovera. It's a handheld device that injects liquid nitrogen gas into specific nerves in the surgery area before the surgery.
It temporarily freezes the nerves off around your knee, hoping to decrease that pain signal that gets sent back to your brain.
He says one 30-minute session can provide pain relief between 3 and 6 months, and that it has pretty high success.
It doesn't work on everybody, unfortunately. Kind of in our practice, or what I'm seeing, is about 70% success rate where the patient does feel some sort of pain relief.
Nebraska Medicine began offering the treatment around 2020. Any surgery patient is qualified for it unless they have a skin lesion or rash. Kildow says he has only used it for knee surgery patients, but that it can be used for shoulders and ankles too. In Moffitt's case, he says he walked out of the hospital after each of his knee replacements, and he was able to stop taking opioids after 3 days.
The joint pain and the bone pain that I would expect to experience with this type of surgery was gone. I had none of it, which then allowed my physical therapist to be a lot more aggressive with my rehab.
Dr. Kildow says on top of being addictive, side effects from opioids include dropping blood pressure, constipation, sleepiness, and dizziness.
Especially in our field of work, where we do have to prescribe opioids for our patients for pain control, and trying to find other modalities to cut down on that is key.
On your side, Joe Harris, 6 News.
Ortho Nebraska also offers Iovera. To learn more about this cryotherapy treatment, we have that information linked for you on WOWT.com.